interest and your passion to support folks who've experienced trauma. Tell me a little bit about your journey as a therapist and how you treat it and how you've come to using EFT to support folks.
Yes. So, long journey. I'm gonna try to make it short.
Mhm.
Um, but I started out supporting trauma survivors like fresh out of college, like rolled out of college, right into residential treatment facilities, working with adolescents. So foster youth who have been, placed there for treatment. Um, that's a conversation for another time. But so they came with trauma, right? Like they're disconnected from families for reasons, whether it's like physical abuse, emotional abuse, things of that nature. So I at that time I was a behavioral health specialist, so just supporting them in the milieu. And throughout my journey, I've always worked with trauma survivors, whether that's in behavioral health centers like 5150, psychiatric hospitals, working with the TAVE population, again, foster youth who might have histories of like juvenile delinquency, like things like that. So my experience has always been with survivors.
Right.
Now, the way that I was trained was not necessarily conducive to people who live with trauma, if that makes sense. So a lot of like top-down approaches, like behavioral modification,
I see.
like CBT, things like that, where it's like, okay, let's change your thoughts and your behavior so that you can, feel better or do better or whatever. And what I learned, throughout my journey is like it doesn't start there.
Yeah.
It starts in the body.
Mhm.
So as I transitioned into my own private practice a while ago, I kind of like copy and paste it, right? Like,
Yeah.
okay. And my rationale was like, these systems are trash. Throw away
Yeah.
the system. I'm going to be like the best therapist. I have the tools, right? And
I have the
I
answer.
have the answer, right? And I got in my practice, I was like, oh, wait, I don't have the answer because outcomes are not proving that I have the answer, right? It can't be everybody. And it wasn't every single person on my caseload, but it was
Right.
too much for me,
Yeah.
right? And so I definitely had to go back to the drawing board and really do some trauma training, like
Yeah.
really learn about like what trauma looks like,
Yeah.
how to treat it, all of those things. Long story short, I was doing my own therapy, like for my own like work.
Mhm.
And my therapist was like, have you ever heard of EFT? I'm like, no, tell me more. And she was talking about a different EFT. Um, I don't know like the word.
Emotional focus, probably.
Yep, emotional focus therapy. And so as I was researching, my EFT populated. And I was like,
Mm.
what is this about?
Mhm.
And it that's where it started. And I have been in EFT for a while now, just doing tap in with people.
So what does EFT stand for?
Oh, emotional freedom technique. Yeah.
Okay.
Yep. So that is my main modality. I use some other somatic things, but that's like my primary thing.
Yeah.
Yeah. What about you? How'd you get into EMDR?
Well, similar experience. We're both social workers, right? Trained, got our master's in social work. So I think the shared journey of supporting folks who were at risk. I've been a social worker since I was 17. And when we think about folks who are at risk, these tend to be folks who have had some really overwhelming traumatic experiences. So when it comes to EMDR specifically, running into folks who have had long history of life experiences,
Mm-hmm.
and while it was very supportive to even just have someone to talk to, you do need a certain level of skills to help people move through it. And talking can get you so far. So traditional talk therapy is like a sacred practice. It is a special place where people can just let their lived experiences kind of breathe and
Mm-hmm.
just let it out
And be
and
heard.
contain.
Mm-hmm.
But it's not always, it doesn't always produce lasting effects.
Mm-hmm.
And so, having worked with people in ERs and ICUs, I was able to provide brief counseling and support, which was helpful, but I was more interested in like what happens when they go home.
Mm-hmm.
Um, how are they going to get some support after realizing that they can never walk again, or they have this diagnosis and they live alone, or whatever the case may be. So that's what interested me in going into private practice. In private practice, we're talking with folks, and it was like you know, I think I need more training.
Mm-hmm.
And that's part of our code of ethics as social workers, is to know when we are limited,
Mm-hmm.
in what we can provide people, and we have a duty to expand our expertise if we're going to work with a certain population. And so just taking more trainings on trauma treatment, the effects of trauma, you know, learning about the ACEs, the adverse
Yeah.
trauma experiences, the different ways that people are experiencing trauma,
Mm-hmm.
was one really interesting to me. So just, you know, getting more trainings in general. But then I start hearing about EMDR from other colleagues, like, hey, there's this new, and it's not new actually, but it was new to me. This new modality that's super helpful for folks with PTSD. So I looked into it and I was like, oh, okay. I'm personally really like structure and frameworks.
Yep.
I like learning about learning and how I can pass that to other folks. And EMDR provided a lot of really good information to me on how the brain and the body worked.
Mm-hmm.
And so it piqued my interest, to be able to communicate that. So took a training, and really liked it, used it a little bit after, and I really didn't do anything else with it. So to be an EMDR therapist, you just need the training, but not all trained therapists become certified, which requires
Right.
like clinical supervision for
Mm-hmm.
a certain amount of time,
Yeah.
meaning somebody else can attest to your work and they know that you're honoring some of the steps. So for me, EMDR, I was doing it and wasn't really feeling it, didn't feel natural for me. But as I took more trainings on EMDR, you know, there's a lot to become certified, takes a couple of years actually. But it just made me feel more empowered as a clinician to support people with some of the complexities. And it is my primary modality in how I support people, because I found that it provides lasting change.
Yeah.
So
That's important.
sometimes you can get those glimmers and, oh, I feel free and I feel lighter. And then you come back to the cycle again, and it's like you're having to do it all over again. With EMDR, I found that people are getting some really deep rooted healing support that really changes the trajectory of their life and how they feel about themselves. So I tend to use this modality, because it feels better for my system as a clinician.
Mm-hmm.
I found that it's been really helpful for the clients that I support.
Yes, 100%. I think we are alike in that way as well, where the structure and just kind of like step by step process with some wiggle room, or just kind of implementing like your own style to it. But that's another reason
Oh
why I
yeah.
like EFT too, because it's like just
Mhm.
tell me what to do and then I can do it. So that has been powerful. And I hear you with the long lasting changes. It's like, yes, that is so important to have a modality where, okay, we've processed some stuff and now you are not the same anymore, right? Like, because we've cleared out some stuff. So
Yeah.
yes, absolutely.
So I think this is a good transition to actually hear more about EFT. Can you give us a brief intro about this modality and how you use it to treat trauma?
So with EFT, I actually dipped out of the therapy world for a moment, because it's not within our umbrella. So I'm certified in, I guess it's called energy psychology over
Okay.
there. And you know, what EFT essentially is emotional freedom, right? But it's basically acupressure,
Okay.
with no needles. So you're tapping on different, what they call meridians. I call them energy points, just so people can understand it a little bit better, in the body that lock in stress. or
Okay.
trauma, right? So we're literally tapping on different parts of our body, creating the flow. Because what happens is sometimes when things happen, we get stuck, we get tense, and that energy, if you don't process it, it won't go anywhere. It'll just
Hmm.
stay there, right? The clenching of the teeth, the earrings in the shoulders,
Yeah.
gut issues, all of that, all of those things. So what we do is we focus on pain points, specific to traumatic events,
Mm.
and we tap through whatever is coming up. So as you're talking about the experience, and sometimes you don't even have to talk, depending on what we're
Yeah.
working through. You're also literally like processing it in your body, and whatever's coming up for you, it's flowing through you.
Hmm.
Um, so that's a little bit about the modality. It for trauma, what I would do is I wouldn't go back to the trauma first,
Yeah.
especially if I don't know the person. Like if
Mhm.
we're still learning each other and all of the things, first of all, we're going to resource and just make sure like your your toolbox is good before we even
Right.
do work.
That they're nice and prepared for it.
Exactly,
Yeah.
exactly. And then we start with just like stabilizing where they are now. Like, let's just get you functioning in life. What's your biggest pain point right now? And typically, once we talk about the in the moment pain point, then we get to pull back the layers of the onion, and
Right.
then we'll get to the root. But it's a lot of like relational work, um, and things of that nature before we get to the trauma. So I try to create a safe space,
Right.
um, because typically the people that I work with already have trust issues, and I don't
Hmm.
want to be a part of that
Yeah.
that pile.
Yeah.
Mhm.
So similar to EMDR requires a lot of preparation before we
Mhm.
get into it. And any responsible trauma therapist doesn't necessarily start talking about the thing.
Mhm.
we
Mhm.
we know that that can be more aggravating, more disturbing, cause more issues if we go for the jugular. Sometimes it's,
Yeah.
I don't know about for you, but sometimes clients get a little frustrated, like, well, why aren't we talking about it yet?
They want to. It's like that trauma pull. Like I want to talk. I want to talk. I want you to hear my story, right? Yeah, I get that a lot.
And it's
Mhm.
not that we're not trying to hear it, but we're aware that there needs to be a care practice that can help you tolerate re-experiencing or re-talking about it.
Mhm.
So with EMDR, it stands for eye movement desensitization and reprocessing. It's a lot of words that just describe what the process can look like. So it uses eye movements going back and forth. And our goal is to desensitize whatever disturbances you have related to a past event.
Mhm.
And the R is reprocessing. So we're going back there.
Mhm.
But similar to EFT and tapping is that you don't necessarily have to talk about it. So it looks a lot different and it feels a lot different than traditional talk therapy because you're moving, you're doing.
Mhm. Yeah.
It is a brain-based type of therapy. It believes that your brain has the ability to create new connections.
Mhm.
And we know the brain and the body, you're using the meridians, the energy. We're actually using your nervous system. Because that's where folks, like, oh, when I think about that thing, my stomach hurts, or I'm having a flashback, I'm right there. We know that a lot of lived experiences are through the body, not necessarily the brain, but they're
Mhm.
one. So
Mhm.
it really helps with aligning the system so that whatever's trapped in our brain, or I'm sorry, our bodies, we can move through it and that healing feel real. Now, it, like I said, it looks different because the therapist, we're not talking as much.
Nope. Mm-mm.
So clients are used to saying something and we're like, okay, making some connection. We don't
Mhm.
do that in EMDR because we believe you have the ability to come up with your own information, your own solutions,
Mhm.
because your body and your
Yep.
brain are designed to care for you.
Yes.
So it
Yes.
gets to build that trust.
Yep. Yep. Our job is to get you grounded so that you can start to align with what you already have embedded in you, right? It's just like clouded with the trauma.
Yeah.
Um,
And so those preparation phases, with EMDR's 8 phases that we work through. So there's the history taking, there's the preparation, the resourcing. When we call resourcing, it's like coping skills, self-care practices that we want to make sure that you know how to do when it gets real. I only see you for a certain amount of time per week. You got to be able to take care of yourself the rest of those hours. So that preparation, although it may feel a little frustrating and we're not just going there, are really critical to your treatment, being able to tolerate it when we actually start reprocessing. So you're doing stuff, your eye for EMDR, it's eye movement, but it can also be touch or sound. So the ultimate goal is that we're activating the right hemisphere and the left hemisphere of the brain so that they can communicate. And the eyes, connect to the brain. And so we believe we can create that natural process that your brain uses for processing. It actually does it when you're asleep, during your REM sleep, which is rapid eye movement. But we could do it while you're awake. People say sleep on it. You may feel different because your brain has had time to process it. Well, we do that when you're awake, but it looks different and it will feel different because your eyes are going back and forth as you're thinking about that negative experience and how you felt about it. But it's also touch. So the one I really like is the butterfly hug. And it can be used for adults and children. It's super effective. But then there's also sound that has like sound tones that transfer from different ears. You can also march, right, left. So it's kind of like a workout.
That's cool. That's
really tired when they do this, but you can feel the benefits of relief almost immediately.
That's cool. I've never